Thank you, Dr. Sajidi. And I think it's a little difficult topic to speak on, especially when you're looking at periodicals and assessment with relevance to cornea fellowships here. So I also learned a bit, and when I did a little bit of digging to really see what is going to be more relevant as a material to talk on periodicals and assessment with relevance to cornea fellowships. No financial interest in anything during the mention of this, during the course of this talk. Yeah. So, what one needs to look at when you are looking at any medical fellowships. So, in particular, cornea, because that's my field of interest here. What do medical education fellowships commonly provide you? They provide you training in teaching. They provide you how you learn to assess what you are being taught or what you are doing here. You also learn about the program administration and also look at the scholastic or the scholarship facilities which can be offered in any fellowship program here. So this is how you would comprehensively look at a fellowship program. So how would you go about assessing a particular program when you want to probably be part of the program or you're trying to pick out a program for your kid or kid here? So there are two ways of assessing many programs here. You assess the competency of a fellow who's undergoing a particular program here. So that is assessing the trainee here. The second aspect is assessing the efficacy of the fellowship program itself, meaning assessing on the whole the program itself or how comprehensive it is in terms of catering to the needs of the fellow. So there's a great variability among the programs which are available when you particularly look at Indian programs, the scope and intent, the extent of the training here, and expectations regarding clinical competency which one acquires while going through a particular program here, be it clinical or research here. When you look at assessing competency of trainees or fellows of a particular program here, what we need to know about is the core knowledge, how much we learn in patient care, the procedural competencies, the research competencies, and also looking at the administrative and business aspects of practice here. So what is the longitudinal impact of fellowship training? So you could assess it by looking at the descriptive statistics on the program characteristics here, meaning what is the in-depth offering of a particular program here. You can look at the particular employment history of fellows who have undergone or gone through the particular fellowship, those who have been able to assume leadership positions after the particular fellowship here, awards and scholarly activities. So these would be descriptive statistics based on which you could probably assess a fellowship program here. When you look at what do fellows commonly require or how do they go about their training, there are two ways. You look at the clinical work you do and the research activity associated with clinical work, and the other is the pure research activity itself here. Clinical work largely for fellows becomes component research of what their mentors are doing, or they could do a standalone research by themselves depending upon their field of interest. When you're looking at research activities here, largely it is a self-motivated research reading which is going to be guiding them and make them learn more here. But they can also work as research assistants simultaneously. And a large amount of learning comes through optimal research writing as well here. In research reading, the challenge is identifying the right kind of publications which is going to add on knowledge because there's a multitude of literature which is available for any particular subject here. So one of the ways which is commonly adopted when you're looking at periodicals in fellowship training is the journal clubs here. I think due to the lack of time, I would not go into much deliberations regarding this, but when you look at journal clubs, they help you to improve your critical critique skills here, which means you learn to critically analyze a particular research article which is being presented to you here. You're also keeping yourself up to date on a particular subject or a research which is there in a particular literature which is being published here. You're also able to translate what evidence is available in literature and guide it and take it to clinical practice here. And one main thing is it keeps you in the habit of reading scientific literature. So that's very important to put us and so that we don't become redundant in whatever we are practicing in. There are several formats of journal clubs, the traditional formats, the evidence-based formats, the innovative flipped journal club formats, the virtual online journal club formats. I think this is all available for wide reading wherever you want to look at it. But by and large, each of them have their plus and minuses here, and each of them, the components of learning are really huge and do help you to take you forward in many ways here. So that's how you could apply periodicals to your particular fellowship training here. But the need of the hour and what is perhaps coming in most of medical training here, be it residency or fellowship training, is developing what is known as a CBLA, or a competency-based learning and assessment program. I think parts of this is already being incorporated by the Indian government in the MBBS training now here. But I think we would also need to think about reaching out and incorporating it as a uniform protocol to the various fellowship programs which are being offered across the country here. The main components of these would be the training program itself. What are the components and the characteristics and the logistics of the particular training program? How would you go about assessing the efficacy of the program and the fellow who is trained in the particular program, the learning that is achieved, and the management aspects of this? I think this is a fantastic article which I would urge you to read upon, and it talks about in greater elaboration on all these four arms of the system here: teaching, the teaching system itself, specialist training system itself, and how you would assess both the students and the trainer in a particular system, and the management aspects of these particular arms of the CBLA here. So that's something which would be which would really take our fellowship programs at par to international standards of top level fellowship programs here, and that perhaps would also bring in some code of uniformity to what we are having in our current existing fellowships. With this, I close, and thank you for your patience there.
Thank you so much, Vanathi ma'am, for the wonderful presentation. One of the things which I wanted to know in your hospital, where you have a postgraduate also, where you have a junior resident, senior resident, you have fellows. So once you are going around taking classes, how do you actually train? How do you differentiate between training all this? Do you have separate training programs for each of senior resident, junior resident? Or?
Yes, we do have different teaching programs and various formats of teaching programs in terms of didactic teaching here, then clinical bedside teaching, operative room teaching here, and where you teach them in different aspects, not one particular aspect. So if you see, the undergraduate training classes are separate, their competency-based skill assessment and those timings, and those we have a separate roster to that. The roster for teaching, didactic teaching for our postgraduates is particularly different in terms of teaching which is faculty teaching based, in terms of teaching which is based when we encourage them to participate in seminars, and that helps them to develop their thinking skills, their presentation skills, their assessing skills of a particular clinical question which is being posed to them about the subject which they have to discuss. They are also trained in how we have to assist in particular cases, and they also undergo a structured surgical teaching program in terms of, if you think about any particular surgery, starts with cataract surgery, they undergo a certification on all the steps, after which they are given hands-on on humanized training.
So I think RP Center is the only center in India where you give a certificate for the surgical skill also. Somebody who passes
before we allow them to handle humanize, we know that they have acquired a certain amount of competency in terms of doing the basic steps here, and that helps us to decrease the amount of intraoperative problems which one might face, and it also does not adversely affect the morale of a surgeon who's a surgeon in making, because you do, I think, understand when you have a lot of mishaps during your training period, you tend to be underconfident in particularly developing those surgical skills, which is not something which we want.
Dr. Vanathi, do we have any umbrella like EUPO in the US which would, make sure that there is uniform imparting of there any
I think in India it comes only as a governmental advocacy, and I think even for example, if you look at NABH, it's not a governmental advocacy. And I think you're well aware there are a lot of people who are against the NABH norms as well, and they say, why do I have to take NABH? Why do people come around? So it's a form of an advocacy Only if it comes from a governmental setup and makes it mandatory is it going to become a reform. Otherwise, it's going to be largely an initiative of the training center to adopt a particular protocol and perhaps better it can enhance its own performance. That's perhaps what we are seeing currently.
Thank you so much for that wonderful presentation.